Thank you so much for a very interesting presentation, Jaana. Jaana is going to stay with us for this following conversation. We are also joined by Juuso Blomster, who is Adjunct Professor of Cardiology and CEO of a company called Precordior. We're also joined by Chief Scientist of Oura Ring, Hannu Kinnunen, who is joining us remotely from northern Finland in Oulu. Hi, Hannu.
Hi.
Great. So, what thoughts did you guys have about Jaana's presentation? Do you agree with her that people don't actually understand enough where they are sharing their data and we need more data literacy?
Well, I can start with that one. I think you have a good point there. If we think about that, majority of us who are addressing the terms of use in their apps or elsewhere, they don't actually read them. They just press OK and go with it.
I know, I do that all the time. I probably signed away everything.
Yeah. So I think that's true. There's a point.
What about you, Hannu? Do you agree?
Yeah. On the other hand, we don't even realize the huge opportunities that there are if we really could combine all the information that is collected from us. If we could have them together in some place and have like machine learning and have like people from different areas of science really analyze them together. That's also a huge opportunity.
That was the beautiful vision that Jaana was talking about. Actually, I would love to hear what our audience thinks. So please use the group chat function under this window and let us know by posting your comments. Like, do you agree? Do we need more data literacy? Hannu, you're Chief Scientist at Oura Ring, a Finnish wearable. Now, if there is someone in the audience who doesn't know what an Oura Ring is, could you please briefly explain what it is?
Yes, thank you. Oura Ring is like a 4-gram ring that measures your pulse at night. It measures your movement day and night, and it also tracks your skin temperature. So combining this information, it can build a holistic picture of your like health-related behavior and your body responses from general health perspective. And it can derive your sleep schedule, estimate your sleep quality and physical activity status, and also your body reactions to your lifestyle. And the idea is that people learn by seeing how their body reacts to different things, what they eat and how much exercise they do, and if they are able to relax in the evenings, and if they can see positive changes in their sleep parameters and especially like resting heart rate and heart rate variability.
So does your service also sort of educate people? Like, if you can tell that I'm not sleeping well or I'm not exercising enough, will it like ping or like show up on my phone and go like, Lotta, you need to go running?
Yeah, from like general wellness perspective, it gives like it like prompts some of the general guidance, like as it seems appropriate for that situation and for that person. Okay,
thank you. Juuso, you're a cardiologist, but also a startup entrepreneur. Your company, Precordior, has created a heart app that detects atrial fibrillation. How does it do that?
Very good question, and I'm happy to answer to that. So if you think about that, our Cardio Signal device, it's a medical device, and inside your smartphone. And what happens there actually is that if you would picture here your smartphone and you rotate that, the landscape there changes like from portrait to landscape, the screen. And those are motion sensors behind that. So those same motion sensors we utilize. So when you place your phone on your chest, we get a detailed reading of your heart. So basically you could say that we are measuring your heart's recoil. So we understand your heart's motion, and from there we can make this detection of atrial fibrillation. But it actually doesn't end there, since we get so much data. We're actually now working on our next products, which would be detection of coronary artery disease and heart failure in 1 or 2 years' time in the future.
That sounds really cool. I did not know you could just do it. That sounds right. Also, I don't know if the camera can zoom in, but is that an Oura ring on your finger?
Yeah. This is Oura.
Okay. Are you happy with it?
Yes. Yeah.
Cool.
I'm happy with it. Yeah. Cool. You told me this morning that go for it. So very good.
Good, Hannu. You told him to go for it. So you guys both, you collect obviously a bunch of data through your apps and your services. Who owns that data?
That's a good question. My argument would be that, or how I see this, is that the person whose the data is from owns the data. Like, this is how I like to think this. So, for example, if we think about our healthcare system, the hospitals would be the ones who are actually managing it for us, but we are the owners of our own data. That's like my vision for that.
Hannu, do you agree?
Yes, it is of paramount importance that we as like we have like a real control over our own data, and that said, like in an aggregated, non-identifiable format, these databases are also like can be used for the benefit of the customers by the companies. So the question is real that the aggregated power of the data, it's also at the use of the companies, but it's really important that always the users have the right to say where their data can be being used. If they can, in minimum, they can like take their data out.
Do you have an example of how Oura Ring can aggregate their data to show bigger trends?
Yes, like I have like one example slide where we can see how resting heart rate is how it behaves in different localities among Oura Ring users in an aggregated form, showing an average resting heart rate. And there you can actually see in blue line the year 2019, and you see how like there's some seasonal variability, like during the summer holiday the resting heart rates go down, and during Christmas time it goes up, and especially high during the New Year's Eve. And every single weekend the resting heart rate goes up, displaying that some unhealthy behaviors that we typically as human beings do during the weekends. And now when the COVID pandemic hit us, surprise, our resting heart rates have collectively gone down. It's like some positive things also there. Like we can see how the difference between weekdays and weekends has become smaller. So and especially Singapore, it's a huge improvement in resting heart rates during lockdown, because I think they have a delayed rhythm in that country in the patient. So stabilizing your rhythms is one example of how you can positively impact your health. And here we can see like the power of wearables in displaying how our society impacts our health, and how it has capacity to impact like okay, it's a little bit far from here, but like teenagers, schools should start a little later, and that effect would be seen by wearables as improved resting heart rate and also performance, I think. So
before we had wearables, there was no way for us to get this type of data, right? But your survey said that it seems like that surprisingly many people start using wearables, but then they give up, except for Finns who keep them longer, right? That's what your survey said. But why do you think that is? Why do you think people just give up?
Well, I had one very interesting finding from the survey was that Finns were much more keen on monitoring their sleeping data. So maybe in the press we are talking more about the importance of sleep and good sleeping. So that was very typical for Finns. But I also had my Wittings watch for monitoring mostly my sleep and also giving trends for my kind of well-being and all background factors. But then when the COVID crisis started, I kind of felt that, okay, suddenly without any traveling needs, I suddenly find much more time for sleeping, going out for nature. So that's also part of the well-being. So I didn't feel that there's so much need for continuous monitoring, but still I'm thinking to take it in use again. So I don't know, maybe it's also urgency how you need. And also I think there are a movement for quantified B. So the forerunners are very keen on monitoring and also building all their well-being and health with different sets of data. So
how many different devices do you guys have that collect some sort of health data or apps?
I have my Oura, and then I have my phone. So,
yeah.
So that's it for me.
Okay, what about you, Hannu?
Yeah, it's just like when I'm preparing for a marathon or something like it. Then for some period, I take a heart rate monitor to see the more exact sports data.
But if I actually may add to your question there, the thing why actually I think that many people stop using wearables is that the problem or the issue there, if we would use that word, is that it is additional tasks that they need to do. So for that perspective, this ring is good since it's always there and it does the measuring passively. And then the other thing would be that the information that we get from there, it has to have a meaning. So it doesn't help if we are just looking at puncher numbers and it says something, but we don't feel differently or so. I think from the fundamental perspective, humans are a bit lazy, maybe. If we think about what happens there, we for example, medications. If we had a severe health condition and we're prescribed for a drug, we see and we know that actually there are significant proportion of individuals who still don't use the drug even though it should be used. So this is a bigger problem than just wearables. I think it's a human behavior, and how to change that, that's another question. But giving meaningful data so that people actually understand what it means, I think there's one of the keys.
So we were talking earlier about this combining of different sorts of data to get a more holistic view. And this survey said that 43% of Europeans were either interested or very interested in sharing their personal wearables data with multiple organizations to, for instance, get new services. Now, I don't think that's really happening very much. Why is that? Is that a technical problem or is that a communications problem? Is there that there aren't ecosystems or platforms for this? What do you think, Jaana?
I think it's attitudes of course, but it's also technical means. Interoperability is the term we are always referring and using that as an excuse. There's no interoperability between the data, and I think, well, there are certainly solutions to overcome that obstacle, but also maybe the concept of data ownership. I would prefer to talk about temporary data holders, like tailored services and meaningful use of data for specific purposes. That's the way to go for the future. So data sharing, also Gartner, which is the well-known analyst firm, says that storing of data and holding it for ourselves, that's old school. It's now like sharing data and building services for the shared data, but it's a huge step. We are so used to operate on our own data, and we are also so used to holding it. That goes for the companies. And then us as an individuals, I think it's maybe that professionals, they don't have means to use the data, and it's maybe not like good quality data. So there are many technical topics, but also the mindset change is needed, I would say.
What do our data owners / temporary data holders, our companies, what do you say about this? What is the reason that you guys aren't sharing data with each other?
Well, we're not sharing data with each other yet. So that's what I would like to actually point out. We are actually looking into this opportunity to share data, but naturally it has to come with certain terms. So we need to respect our users, and they come first from this perspective. So this goes a long way to the regulation that we have, GDPR and everything, what is there. So how are we able to do this? And actually, I think that kind of like a common platform is still missing in Europe. In US, what we see there, Apple HealthKit, for example, is now trying to combine a lot of wearable data, what they bring themselves, and then share it with hospitals so that it would have like a kind of like a meaning as a whole, not just like a, kind of like a fitness tool from what you're gathering and understanding your fitness or health from that perspective, but also from a medical perspective. Since from a user perspective as well, there's no difference, you know, whether it is a non-medical device or medical device that collects your data, or you do it yourself. They don't see the difference, but we see, and this is kind of like the hurdle that we need to overcome.
Hannu, do you agree?
Yes, I agree. There are changes needed in the ecosystem, legislation, and attitudes, also among health professionals. And we need pioneers who really can show the potential. And as Juuso mentioned, we don't share data yet. If you look at the second slide that I had, it actually displays that what quality of data right now, like the ring measures from the PPG signal, and there's a comparison to clinical ECG. And as Juuso, as a professional, I can easily see that, well, ECG is our clinical standard, and we're not going to change that. But understanding that that kind of high quality pulse interval data is going through, like literally through our fingers, that kind of gold mine, we let it go unused. So understanding that kind of long-term data where everybody can be compared to one's own norms, and that data could be combined with medical records, that we could really start tracking the course of a disease before it actually happens. Like as an example, during pregnancy, like even body weight is taken like periodically. Why not take your resting heart rate on arterial stiffness or your cardiovascular performance parameters that can see from the signals, and make those norms, and have everybody like see like the good course, and be relaxed when nothing bad is happening, and then get an alarm if something alarming is happening. So this can become reality in a few years, but that as to summarize, even legislation and our attitudes and our collaboration need to improve.
Sitra, I think you have a lot of work to do to lead this.
Oh yeah, it's not done by tomorrow.
No, I know. Did you want to add to that?
Yeah, actually, I really like that comment there. But what I'm also thinking is that maybe from a professional perspective for us, it is easy to understand all the data that is coming from there, and we're fascinated about it as per our nature, basically. But what we need to also understand is that how we could actually formulate the message for the user so that they understand that this is actually what it means. Since otherwise we may end up in a situation where, you know, too much data is causing anxiety even. You know, what does this mean? This number was yesterday 50 and now it's 75. Am I sick or something? Yeah. So, you know, you just maybe start focusing on the wrong things. And this is the message that we need to, you know, get through, that, you know, what is the key there?
I understand. I have a quick question from the audience, actually. So maybe more for Jaana. Are there any studies ongoing to find out the impact of lifestyle through like my data at the population health level? So is the impact of tracking and changing behavior? Do we have studies going on about that? Do you guys know? Anyone?
Well, we are focusing on cardiac. So we're focusing in your heart. So basically, direct way of assessing lifestyle in our cases we haven't done yet. But naturally, it doesn't mean that they are not important. So that should be and is an essential part of our health, naturally.
More generally, like the physical activity levels at 5 years already like associate with your activity levels in your adulthood. So this question is really important. How much do we have in our genes? How much we can really affect by our lifestyle solutions? And there is a lot of studies on this, but unfortunately they are in silos. Like different people study cardiovascular health, different metabolic health, different people studied, like exercise physiologists are different than sleep physiologists and nutritionalists, and we all kind of try to wish to find how lifestyle affects our health.
That is a great note to end on, because that is basically coming back to what you were saying beforehand, how we need to be more open-minded about sharing data in a responsible way and more human-driven European data sharing networks. We've run out of time. Thank you so much, guys, for a really interesting conversation. I hope you have a great day.